Specialized eye treatment in Uganda can get quite expensive. Because you have to imagine, first of all, being able to access that cost. There's the transport cost that you incur to be able to access this cost. And then once you get to the facility where you're supposed to get the specialized eye care treatment, then you have to pay a consultation fee. And then essentially now you have to pay whatever prescription or management for your eye problem has been prescribed. So for instance, when it comes to the optical industry, you can find glasses going for as high as 1 million Uganda shillings, which is very expensive, and not everyone is able to cover that cost. First of all, the thing that is advised the most when it comes to families, and I'm talking about kids in this case, is that parents need to be very careful and very observant with their kids to start noticing if they have any eye care problems from a very early age. Because when these problems are sort of diagnosed early, then it's possible to offer management that can be able to save that child's eyes. So it's very, very important for parents to listen to their kids whenever they complain about eyesight, whenever they say that they're not able to see on the blackboard when they're in class, or they have difficulties reading their notebooks and their textbooks. And then when that happens, the ideal thing is to take that child to an eye care professional to go through the eye test and to be able to get advice on the best way to take care of that child's eyes. But also in general, as a family, it's also advised that every single person gets their eye checkup at least once a year. Because then when this happens, then the doctor or the eye care professional in this case is able to diagnose early enough and to be able to offer the management needed. The Ministry of Health estimates that in Uganda there's about 1.2 million people that are suffering from reduced vision. And there's actually about 250,000 people who are blind in both eyes. The situation is calling for action as soon as possible. Because the 250,000 people who are currently legally blind, it's possible that that situation could have been prevented early on if it had been diagnosed early on. So we as Lapea Group call upon every Ugandan to put eye care as a priority and to go for their yearly eye checkups with their eye doctor. As a country, if we do not start putting eye care, making eye care a priority at the moment, then the statistics estimated by the Ministry of Health of the people affected by reduced vision and the statistics of blindness as well are going to keep increasing. It's going to get much, much harder to be able to carry out our daily activities. The very simple things that we're used to, waking up in the morning, making tea, preparing your kids to go to school, going to school, working and all that is going to become quite difficult if we do not address the eye care problem that is affecting this country. It's also important to note that the World Health Organization estimates that by 2050, half of the world's population is going to be legally blind. So this is not something to wait for. It's something to start putting as a priority at the moment. It's also important to note that the World Health Organization estimates that by the year 2050, half of the world's population is going to be suffering from myopia. Myopia in this case means short-sightedness, which means they won't be able to see things from far. All this can be corrected and managed in advance if we go in for our yearly eye checkup. As Lapea Group, our contribution to mitigating these statistics about eye care is that we offer affordability. First of all, when you walk into any of our Lapea stores, you will be tested for free, so that minimizes the consultation cost that you would have incurred elsewhere. And then our glasses are very affordable. So at the moment, for instance, we have about 6 branches in Uganda, and we're actually planning on expanding to more regions of Uganda. Our goal potentially is that no one should ever have to go for more than 30 minutes without accessing the quality eye care that they need. In line with our goal to make eye care accessible to everyone in Uganda, Lapea has gotten into a partnership with the Uganda Muslim Supreme Council to be able to screen the eyes in all of their mosques across Uganda. If you are affected by, you have any kind of eye problems, be it you have problems seeing from far, or you are affected by light, or basically any eye problems that you may be experiencing, follow us on our social media platforms, because we will be announcing everywhere we'll be going to conduct this vision test. And we also call upon other religious communities to take advantage of this opportunity as well, it's possible for us to partner with them and arrange the eye care services for their congregation as well.